All right. Well, good morning, everyone. It's another fantastic Monday morning here at Healthline Markets. Thank you guys very much for being here live on the call. We have a special guest for later on today. We have Adriana from United Healthcare. I see she's on there. Thanks for finding us. And we're going to pass her the mic in just a little bit so she can give us an update on what's going on at United Healthcare. So as we normally start here, remember, guys, we are here to improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And thank you for being here live, because this is not just for Healthline Markets, and it's not just for you, it's also for your clients. Please remember that, you've got to stay sharp in this business in order to give accurate information to your clients. And very proud for everybody being here live so they can start their week off on the right foot, getting the most up-to-date information on the industry and what's going on at HPM to enhance your career as an agent. So I do want to say thank you, and I appreciate you guys for being here and making a habit of being here. We are hosting these on YouTube, so if you do have a Monday morning client that just absolutely has to see you at 9 o'clock, then clients come first. We are going to be recording these so you have access to them in the future. So just know that. As we normally start, I'm going to share my screen. Before we go through the training, though, I do want to let everyone know that this week we are doing some last minute remodeling. Actually, the finishing touches really of the Edgewater office. So they're going to be creating quite a bit of a mess there. So we're not going to be at the Edgewater office this week. If you need to see us in person, we will be in the downtown office, which is where I'm at today. And again, that is 300 South Orange Avenue, Suite 1000 on the 10th floor. Come see us anytime you'd like to. Appointments always appreciated. That way we can make sure that somebody's here to greet you and meet you. We are working this week. You can call us, same number, same email. Again, 844-696-3975. And then support@askhpm.com. We're here to support you. We just won't be at Edgewater, so don't show up, because the construction folks are going to look at you kind of weird. Like, what are you doing here? So just want to let you guys know that. I am going to share my screen here for the training calendar. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. So in HQ, remember, you're going to go down to learning, pop that open and click training calendar, and you'll have all the latest training calendars for the week. This morning, we've got Cigna, and they're doing Understanding the IRA, the Inflation Reduction Act. That is for 2025. They're going through that at 10 o'clock this morning. UHC is covering TRICARE at 1 o'clock. I'm getting a lot of questions about TRICARE. You probably want to be on that training. And then they're also covering the DSNP and CSNP deep dives as well. I'm not going to go through all of these trainings, but I do want to point out a couple of highlights here. On Tuesday, we've got Humana doing their retention playbook, their OEP and lock-in. Really important that you continue to learn about that. And then also at 3 o'clock on Tuesday tomorrow, Spark, our partners that bring us the CRM, is running an effective in-person consultation. So, good old-fashioned sales training is there, and super important that you check that out. That's at 3 o'clock on Tuesday. On Wednesday, we've got our very own Al Clancy. He is hopefully back in action. He had a little bit of a stint last week, so he is going to be there at 9:30 for your coffee and chat session. If not, we'll make sure that we have a teammate there to answer your questions. We're going to talk about that today because we got some feedback back from our survey. One of the things that you guys were asking about was coaching. And we actually have some people here that can help coach you. We'll talk about that today. Wednesday, we also at 10 o'clock, we got Baycare. They're doing their broker bistro. That's in Clearwater. If you're in that area, you can check that out. They're going to be at the Panera Bread and in the afternoon at 1:30 in St. Petersburg. So you can check that out. Our contracting team is got an open window at 11 a.m. every Wednesday in case you have any questions about that. Our UHC Golden Rule training with Umer is at noon on Wednesdays. I can't stress that enough because that's another $20,000, $30,000 of commissions in your pocket by learning how to service your clients with additional products that will really step you up and over your competition. So check that out. Thursday, we've got WellCare coming in the office from 9 to 11. So Suzanne is available for any questions that you might have live and in person. Again, this one may move to the downtown location or be canceled. So we'll keep you posted on that. If you are planning on coming over to that WellCare broker manager meetup, please reach out to a teammate so we can get that reorganized for you. Also, we're doing our HQ intro. How do you use this platform? And I'm sharing this with you because we've got some really cool features that are coming down the pipe that we want to make sure that you guys are aware of, especially when it comes to contracting and requesting contracts. It'll make your life a lot easier. So check that out. That's at 3 o'clock on Thursday. And then on Friday, we've got What About Shop with Tom. Tom is there as a coach to help you from 9:30 to 10:30 every Friday. Again, I'm hearing that people are looking for some type of coach in the business, and here we are. We've got a couple of people that can help you and guide you and get you what you need. And then last highlight of the week is Spark doing their training at 2 o'clock, the value of provider partnerships. Those of you that have been hanging around me for a while know that physicians are a fantastic partner in this business, especially if you hook it in right and you know how to work with those doctors. We've got trainings galore to help you get up to speed on how to work with physicians, which can be a fantastic lead source, a good partner, and to help you grow your business. So that's the training for the week. For the full calendar and the full experience here, remember, you're going to go to HQ. If you do not have access to your HQ, please reach out to us. You can simply send an email over to support@askhpm.com. So that's the training for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. I want to pause here for just a moment and let you guys know that last Friday, we took a whole entire day off as a team to really kind of look at where HPM was in 2024, where we're standing now, and where we're going to make sure that everybody is on the same page and going in the same direction. One of the things that I mentioned to the team is that I'm very keen on quality control. So we've got some feedback on the survey, good, bad, and ugly. And I shared that with the team so they understood what your sentiment was on the surveys. We really appreciate those of you that took the time to take those surveys. We are listening and we are making changes, according to your voice. So with that said, if any of you feel that our service is not up to par or you experience some type of issue where, you'd like to let me know, please do not hesitate to reach out to me directly. If you don't have my direct number or direct email, which you all should have, my email at least, please reach out to a team member and I will be glad to speak with you on any of the issues that you might be facing as an agent. I am also a recovering insurance agent and I understand the pain points that you're experiencing. I understand what it's like to build a book of business, maintain a book of business, and get the support that you need and you deserve as an insurance agent. And I want to make sure that Healthline Markets is delivering on those things that you're needing, because that's the whole reason why we designed this company. And it's the whole basis behind it. So just want to make sure that you're aware of that. One of the other things that we pulled from the survey is you guys still are very keen on receiving emails and then secondarily text messages. So we are revamping our whole email communication and text messaging communication and really working on the cadence on what makes sense and how often should we be sending you these things, so you can stay up to date and know what's going on with HPM without us invading your life, every day with an email. So we want to get that right. So there's going to be some trial and error in that. Some of you have already started receiving some emails that we haven't really been sending in a while. So you should see a tick up in our communication, especially on emails and text messages. One thing that I was kind of surprised about was, we also have the ability to do voicemail drops, but it didn't seem like anybody was really into that. So if you have any insight on that, please leave a comment in the chat. If you're, like why you don't like voicemail drops. In my thing, sometimes it's really good for like updates. So that way you don't have to read and you just open up your voicemail and you get a quick update. I don't know. That's what I was thinking, but maybe people get too much spam or something, or it's just spammy. I don't know. So there it is. Also, we got a really great rating on HQ in general, and I was really happy to see and hear that. We know it's not perfect, so if you do have any feedback as far as what features you would like to see in HQ, what would you like the functionality to be? Is there certain things that you need it to do that it's not doing today? These are all things that we really want to iterate on and continue to grow it and make it very easy and seamless for you. The whole idea behind HQ is that your one-stop shop go-to headquarter dashboard for everything you need here at HPM and your insurance career. So if you are needing help with your commissions, it's in there. If you're needing help to request a contract, it's in there. If you need to meet with a team member or need marketing materials, it's in there. And if it's not in there, then we need to know that. So please explore it. Please take a look at it. And we want to continue to build and build and build and build. So it's everything that your heart desires. And it makes it very easy for you to do your business. We know that we need an on-the-go solution as well, which is, a mobile app that's going to be a little bit heavier on use, but it is possible in the near future. So we're going to be talking about that to make it, pretty easy to access from anywhere in the world, including your, on your cell phone, which is a thing. And then also you had mentioned in the survey that you would like to have some self-paced online courses. We are going to be rebuilding HPM University, which will be very linear experience. So you can actually access some of these trainings and do the trainings anytime that you prefer to do them. So, if it's on a Saturday at 10 a.m., you can do that at your own pace. So, that's coming down the road. But I do want to ask your opinions on that too. So if you have ideas on, what kind of trainings are you looking for? What is it that, would really move the needle for you as far as knowledge or how things work or courses? These are all really, really important things that you need to know. One thing I'm going to mention here today as far as a feature with HPM is our legacy program. And next week, I'm going to talk in detail about the legacy program and what it can do for you and your family if something should happen to you, or if you really just truly want to retire without having to do your CEs or keep your license active or take the AHIP or any of that. You have the opportunity to pass on your book of business to whoever you want or to yourself as a retirement present to continue getting the majority of your commissions paid to you and for ever and ever. So if you're interested in that, you can always reach out to us, but I will be sharing some details on the call for next week. So stay tuned for that, and we'll see you on that as far as that goes. So we have some questions in the chat. Nope, just everybody saying good morning. Appreciate that. Gail is asking, is there a change in the prescription plans for our customers? Yeah, there's quite a bit of changes on the Part D program specifically. And then on the prescription drug plans, they came out with the M3P program. And we will be sending out some more knowledge on that. That's a really great point. We can add that into HPM University on how the new Part D program works. Maybe we can get a little bit of insight from Adriana this morning because United has some really great tools and resources that you have available. So Adriana, I'm going to make you a presenter here. And so you should be able to sync and link in with us. I found you. So with that, I'd like to introduce or reintroduce Adriana from United Healthcare She is our partner here in the market. And can you hear us okay?
Yeah, can you hear me?
Yeah, we're good to go.
Perfect. Well, hi everybody. My name is Adriana Leapart. I am the Market Growth Manager for United Healthcare for Central Florida. And actually joining me on the call as well as my counterpart, James Cruz. So he's newer to the market, just started with me in November. However, he's not new to United Healthcare. So Justin, I don't know if there's a way to allow him to unmute too real quick, just so he can introduce himself. Awesome.
I'll find him here. Got him. And here we go. James, can you hear us okay? It might take a second. Ooh, hold on. This is a relatively new system for us too, but here we go. Let's see. James, you should be able to say hi now. Right, Adriana's got, hold on, she's having a mute issue. Let's try that. Oh, that's strange. Well, one moment. Let me see if I can change your stuff here. That's what you get for putting me in charge of this. Okay, James, can you hear us now?
Okay.
Yeah. I got
think
you.
it's working now. Sorry about that.
All good.
All right. Well, James, are you able to unmute now? I'm not sure if you can or not. Looks like. All right. Well, if not, that's okay. Maybe he can just pop on at the end. But so James joined us from Group Retiree Telesales. So he's been with United Healthcare previously and joined us in November. So super excited that we have a full team now for your Central Florida market for United Healthcare. I heard Justin was asking me to share a little bit about Part D changes and really what are the resources around that and what can we help you with there. So one thing to keep in mind is United Healthcare actually has a YouTube channel that is focused on what our Medicare Made Clear product is. So let me see if it will let me pull it up. Sometimes it blocks it. But if you just go to YouTube and type in Medicare Made Clear on YouTube, it will actually pull up the United Healthcare Medicare Plans YouTube channel. So I'm going to share my screen so you can see the There we go. Okay, let me share my screen real quick.
Yeah, by the way, Medicare Made Clear is a phenomenal resource, you know, both on the Medicare articles and also like on the YouTube channel that she's showing you there too. So
Yeah, absolutely. So one thing to keep in mind is this is more member facing, but we have tons of agent facing materials in Jarvis. So I'll show you that as well. But this is the specific YouTube channel from United Healthcare. This channel is going to have things all about Medicare in terms of, you know, when you're turning 65, what is the eligibility? But there is an actual Part D video in here that was launched right before AEP. So keep that in mind that is available in here. It's also available in several different languages. It's this one that you see here. So we have tons of different information on Part D changes that goes along with that video. So again, more member facing here, and then all of the agent facing information is going to be in Jarvis. So let me go ahead and share this.
It's always, yeah, it's always good refresher stuff too. Just watching the member things as well. I pick up some stuff, you know, that has changed. So, you know, if you're not subscribed to their channel, it might be a good idea to do so.
Yeah, absolutely. So when it comes to Jarvis, this is, most of you should be familiar with this, or if you're a newer agent, maybe you're just kind of getting familiar, but there's tons of information here when it comes to United Healthcare for you as agents. And one thing I hear from agents all the time is that they don't feel United Healthcare has enough material. So I want to make sure you're all aware of where that material is, where you can find it. And I also want you to know this is free, right? This is not information that you have to pay for. The only time you're going to see a charge is if it's on something that can't be printed from home. So everything in the toolkit, I would say about 95 to 98% of it can be downloaded and printed from home. You do not have to pay United Healthcare to print those items for you. So there's tons and tons of information here. You can come up here and search for something very specific. So let's say we were looking for the Medicare Made Clear presentation. You could come in here and type Medicare Made Clear. And not only is it going to give you a full PowerPoint option here, they are in the process of doing the 2025 one, but it will also give you tons of pamphlets and things like that that you can print. There's event flyers in here. If you are going to be conducting an actual educational session, you can come in here and customize these flyers or meeting ads and either have them printed through United Healthcare, which you'd need to pay for, or you can download them and print them for free. One thing I do love, though, about the presentation section of this is when you download it, it's downloading a full PowerPoint, which will include notes for you. So you're not having to figure out, what am I going to say for each of these slides? What are my talking points? It will actually have it here in this PowerPoint presentation. I'm not going to open it right now because it takes a little bit to open because it's a larger file. But when you open that up, it will have notes in the notes section.
And let me just add there too, as an agent with Health Plan Markets, if you do want physical flyers printed for you, we will print them for you and either meet up with you and deliver them, or we will ship them to you. We have the ability to do that. And so that'll fill the gap in any print needs that you might need.
Awesome. So another thing that I love to call out when I'm talking about the toolkit is any of our B2B letters. So B2B is business to business, and this is great for those of you that maybe are doing some grassroots marketing, or you want to email maybe some financial planners you're working with or different community partners. You can come in here and type in B2B, and there's one specific to Medicare Made Clear. So if you are wanting to do a presentation, let's say to a financial planner's clientele on educational Medicare, you could go ahead and send this to that financial planner and say, this is what I'm looking to do. The community outreach one is more for specific locations like food banks. Maybe you want to choose, so like in here you can select your audience, so maybe you want to choose, a nonprofit or some kind of retail business. You want some kind of faith-based community, real estate. So anybody that you could possibly partner with, that's going to be in here. So I just love this outreach letter. I think it goes hand in hand with a lot of our flyers and pieces that are in the toolkit, but it's just a great introductory piece. We utilize this a lot in our grassroots marketing training. So I know Justin had mentioned we've got some trainings coming up today at 10. I actually have an agent empowerment session. You should have received the email for that a couple weeks ago. I have one this afternoon on the CSNP, DSNP deep dive. We are going to do some grassroots marketing training. So tons of that coming up. In terms of United Healthcare, for those of you on this call, maybe you're a newer agent. United Healthcare, we pride ourselves on being that Fortune 4 company, meaning that plan stability for you and the members, right? When it comes to plan benefits, and that's something you're going to see through and through, but we also are all about education as well, and making sure that you as the agents are educated and that you have the tools and resources available to you at your fingertips. And so as you can see here with Jarvis, there's tons of that information here. So the agent toolkit is one I just showed you. Sales materials portal, this is where you can go ahead and either download or order any of your enrollment guides. You can order Medicare supplement books. Anything that has to do with actual enrollment can be ordered in the sales material portal. One other thing I wanted to call out today, or I guess two other tools, is our Medicare product portal and our drug cost estimator. So I know a lot of you on this call, use the tools available to you from HPM, but a lot of times I'll get calls from agents that'll say, hey, this tool I usually use isn't really working great today. What do you recommend? Drug cost estimator is a great tool to have as a backup if something is not working properly. Technology sometimes can happen, and we know that, and we want you to know what tools are at your fingertips. So the drug cost estimator will go ahead and show you the medication prices based on today's changes for 2025, with the threshold changes, with the 2000 and all of that will be loaded in here. Another tool I wanted to show you is our Medicare product portal. That tool is amazing for agents. So the Medicare product portal, we launched that pre-AEP 2024. So it's been launched for a little over a year now. And this tool is awesome, not only for looking up plan information, but just to tell you a little bit more about United Healthcare. It gives you some talking points when you are talking to your consumer or your prospect. So if you go here to portfolio highlights, it's going to talk a little bit about United Healthcare, what we're all about. One thing it does call out here is our new CareFlex plan, which was launched in 2025, as well as our CSNP plans and how that's really expanded. One thing I'd really encourage you to do is take a look at the United Healthcare CSNP plan. We have a lot of members who maybe no longer qualify for those dual special needs plans, but they qualify for a chronic special needs plan. Our chronic special needs plan does still give them the healthy food and over-the-counter credit. So if there's somebody that's used to getting that and they no longer qualify for a dual plan, going with a chronic plan is awesome. Those are for people with diabetes or cardiovascular conditions. And then, just a little bit more about United here, right? Just giving you some of those talking points when you're sitting down with a consumer of why United over, our competition out there in the market. Another thing I love about Medicare product portal is a lot of times I'll get texts from agents like, who's the market contact for this area? You can come here to local support and actually select the location you're looking for. So let's say you're just looking for somebody in, Brevard, right? You come in here and search, and it's going to tell you exactly who your contacts are for Brevard County. Okay. And then lastly, with the Medicare product portal is our plan portfolio here. So this allows you to build side-by-side comparisons of the plans for the entire United States. So maybe you're an agent who sells in several states, but you're more familiar with the plans in Florida and not so much in other states, and you want to get more familiar with them, you can come in here and select that. So for the purpose of today, if I came in here and just selected Orange County, you can either select it here or use the drop downs. So I'm going to go ahead and select Orange County, and it's going to show you our featured plans first, based on if they're new. And then, of course, below that, more of like our core plans. So a lot of times what agents will do is they'll compare our HMO, our PPO, and our CSNP plan. Those have really become the three core plans for us in 2025. And then, of course, our dual plans on the dual market have really blown it out of the water this year. I just want to take the time to say thank you to you as agents for all you're doing out there for United Healthcare. We really, really appreciate it, and it does not go unnoticed. I just want to take this time to say thank you for all that you're doing for your members and for United Healthcare. So here you can actually compare these three plans side by side. And you can move these around a bit too. So let's say you're like, what, I'm leaning more towards the HMO and the CSNP. I'm going to put the PP over there. You can move these around how you'd like. It's going to show you all of the details here in terms of copays that come straight from the benefit highlights. If you're wanting to see anything deeper, of course, you can see that in the evidence of coverage. One thing too is if your member is used to having a dental allowance and they qualify for a chronic special needs plan, this plan does come with a $2,000 dental allowance, whereas our other plans are preventive dental services. Now, one thing to keep in mind is our plans do allow our members, though, to go in or out of network for dental. So anytime you see HMO-POS, I still get questions on that. HMO is for the medical, POS is for the dental. So the POS portion of the plan does allow them to go in or out of network when utilizing that dental benefit. The eyewear network, I also get questions on that. That is UHC Vision. So it's really easy to remember that United Healthcare is UHC Dental, UHC Vision, and UHC Hearing. Everything is in-house. The only plan that has a different network for eyewear is our dual plans are going to be the Eye Care Network. So that's the letter I, Care Network. That network is specific to our dual plans, but all other plans, it's all in-house with United. So making it a lot easier for you and the member to remember what their network is. Over-the-counter credits, another one that James and I get is, where can they use those over-the-counter credits? That's anywhere in the S3 network. So Publix, Walmart, CVS, Walgreens, Winn-Dixie, Dollar General, Sam's Club, Uber Eats, Instacart. So tons of options there. I may be forgetting some. Oh, Bravo's on there. And we're constantly adding to that network as well. For your members who are on a dual special needs plan, they can pay those utilities either at the Walmart Money Center or by calling United Healthcare Member Services. Okay.
So, Adriana, thank you very much for this.
Yeah, of course.
The DSNP was our number one selling product, and thank you for mentioning that. That tool that I see right in the middle of the screen, the Medicare Medicaid eligibility lookup, I think a lot of us forget that you guys have the ability to verify Medicaid. Can you kind of show them that really quick?
Absolutely. So it won't let me walk through the whole tool, but I can kind of, walk through at least the first couple pages without information. It just kind of stops here. But a couple things I want to call out here. Thank you for bringing this up because this is an amazing tool. You can look up Medicare or Medicaid eligibility here. One thing I want to call out is sometimes you'll put in the Medicaid eligibility and it's going to pop up a screen. And I'll see if I can find it in just a second. I think I have a screenshot of it, but it'll pop up a screen that will say what plans they have access to and do they qualify. So let me stop sharing for just a second. I'm going to see if I have that document. I think I do.
Yeah, and Mary B, she's mentioning that the Medicare Medicaid tool works excellent. She uses that a lot.
Awesome. I love to hear that. Thank you for that feedback. I think I have a screenshot of it. I just have to find where I put it.
So will it find LIS as well, or is that a separate benefit?
It will. It will. Yeah. So that's what's awesome is it actually will show that, and it will show them what tools that are available to them, the plans that are available to them, and then what discounts as well. I was trying to find, I know I have a screenshot, and if I can't find it while we're on this call, I can actually send it to you. It's just a screenshot basically showing what that looks like. And I know I had it, but it was like way before AEP that we got it. So I'm just trying to find the screenshot really quick.
Awesome. Yeah, it looks like Brenda uses it as well, so that's good. No, I think this is probably one of the better tools in the industry, if not the best tool for Medicaid and LIS verification. One of the reasons why is United has deep relationships with Medicaid because they have a Medicaid product, and only those carriers that work with Medicaid on a daily basis really have a robust tool. So United Healthcare is one of those companies that has this direct access into the state. And it's not just Florida, it's like across the country, which is fantastic. So I wanted to mention why you guys had such a great tool. It's because you already have the data at your fingertips. And so why not give it to the agents? So I think that's pretty awesome.
Yeah, thank you. I can't find the photo. I know I have it, but it'll just take me a second to find it. And I'll email it to you, Justin, and then you guys will have it. But basically, I can explain to you. So once all of this information is inputted, for those of you that use the tool, you're familiar with it. Once you put all that information in here, it will actually populate, and at the very bottom of their eligibility, it's going to show the plans that are available in the market. So it'll say like Y4, Y5, D2, D3, right? It's going to have all the dual special needs plans listed there. And then it's going to say eligible yes or eligible no. One thing it will also show you is, are they partial? Are they QMB only? Or are they full dual? If you have somebody who shows that they're QMB or full, and then it says they're not eligible for the plan, we've had that happen a couple times. The reason being is that some carriers will recognize someone who is a medically needy QMB.
Oh, did we lose your audio? Uh-oh. Adriana, I don't know if we lost your audio there. Let's see here. Sorry, guys. I think I might have lost Adriana. I'm not hearing any audio come through. On the chat, though, I just want to point out a couple things. Thank you, Mary, for your feedback on the Jarvis site. We appreciate that. And Lauren is asking, is there any way that we can have the OTC book printed for the patients that are not able to use the app? Yeah, please see us, Lorna. We're happy to help print anything that you might need. You can call or email us, and we'll be glad to help you with that. Jeanette, Jeanette's mentioning you're getting a lot of requests for rapid disenrollments from members due to the difficulty using the U card. UHC did not create a 2025 catalog this year and did not send them one, so they don't know what they can buy. Many cannot download the app. If they do, their passwords are not automatically saved. When calling into member services to request one, they are being told that they must be homebound to receive it. Agents were not made aware of that in the UHC trainings, that one would not be mailed to them this year. Our team enrolled close to 200 new members. What can we do? Jeanette, see if you can connect with Adriana on that, or James, and then if not, please loop us in, and we're happy to assist on that. We don't want any issues with the OTC there. And then Brenda's mentioning, yes, it's useful and helps me pick up the right dual for the client since UHC came out with 3 new duals this year. Yeah, absolutely. So if you're not sure which UHC dual you should be using, you can go in there and it'll tell you exactly which one to do. So Adriana, so sorry if we lost your audio there for a moment. I know you're still hanging there. Can you hear us? No, so sorry. I'm not sure what's going on here. We're having a bad tech day. Anyway, Adriana, if you can hear us, if you don't mind putting your contact information in the chat here. I know James put his contact info in there. It's James _Cruz, CRUZ, with the number 1 at uhc.com, and you can send him an email. His phone number is 407-921-9872. And I'm sure he can connect you with Adriana. Both of them are fantastic folks in the community that understand our business, and we really appreciate their time.
Can you hear me? I am so sorry.
Yeah, we got you.
I don't know what happened. Like all of a sudden, the light in my office like shut off for a second. I must have lost power for like literally 1 second, and it just dropped all of my internet, everything. So I apologize, guys.
All good. All good. No, all good. If you have a chance, could you share your contact info here and then in the chat?
Absolutely.
And then if they need some more information, they can reach out to you directly or to your counterpart in the areas that they need help in.
Yeah. So right now it says my chat's unavailable. It says it's trying to reconnect it. So I'll just give you my phone number for now. It's 949 835 6232. And I apologize, guys. Normally I don't have all these like technology issues, but it's Monday. So apparently
it is a Monday. It is a Monday. And I put her phone number in the chat for you guys as well if you want to jot that down and give her a call or text, and you guys can connect as well.
Yeah, absolutely. And then, oh, my chat's working now, so I'll also drop my email in there as well. I think you all have it, but just
really appreciate that. There we go. It's coming through. All right, everyone. Thank you very much for your time. I really appreciate everybody being on the call. A little glitchy today. It happens. But we really appreciate Adriana and James for being on the call today from United Healthcare and sharing the good news. Again, if you need anything, if you need help with anything at all, including United Healthcare, you can call us at 844-696-3975 or email us support@askhpm.com, and we're here to help you. All right. Thank you, guys. I hope you have a fantastic and productive week. Take care. Thank you, James. Appreciate it. Thank you, Adriana. Appreciate you.